In 2005, my son Scott died of Burkitts lymphoma in London. He was 31 years old. The first cases were officially diagnosed by Dr. Burkitts, an Irish doctor in the 1950s in sub-Saharan Africa. Little is known about Burkitts lymphoma in the West, so that's why I've come to Malawi. Here this disease infects 1 in 5 children. I really want to learn more about its origin and see what can be done to help the children who are suffering from this disease. Scott's treatment at the Royal Marsden, well, this is now 5 years ago. It was quite dramatic because he'd been flown in from New York, having had a major tumour removed in New York. He arrived in an ambulance and was rushed in to the hospital. But they then took at least, well, it seemed like 2 weeks, just as they'd done in New York, absolutely making sure it was Burkitts, because it's one cancer that needs very particular protocols of chemotherapy to arrest the disease. And because it's so aggressive, they were concerned. So it was very dramatic, it was very worrying. And I remember Scott, the first day we arrived, when I went back to the hospital, I left him just for a little while to go home. And when I got back, he was completely traumatized because they basically had really told him the truth about the disease for the first time. Scott's cancer came back after 3 weeks remission at the end of the 3-month protocol. So he went back into hospital and again really was stuck in the hospital because it was a fight against time, because his tumours were growing, the lymphoma was growing so fast. He was having bone marrow tests, he had all the spinal insertions, so that the last months of his life, which brought him up to November, was pretty traumatizing for him, because they kept saying, we don't know what to do next, we don't know which chemotherapies to use. He was really like being used as a guinea pig, because they were trying to find a combination that would arrest the disease. But what would happen, it was like giving it food, it would just sometimes accelerate it. So his last week in hospital was when we were thinking we were going to have a bone marrow transfer. This was the last kind of hope. They called it the window of opportunity. It meant that they gave him even more chemotherapy. I don't think Scott really wanted to do it. I think he only did it for us. And really what happened, the chemotherapy killed him. I have nightmares about his last week of his life. It was not a happy time for me to see him in such pain, his body not working at all. But he was remarkable. He remained very peaceful. And it was very dramatic when he died. His body just shut down. And his last words were to me, "Mum, I really, really feel ill. I really feel ill." And that's, his body shut down. And his actual last words were, "Please, Mum, don't let them move me. I'm in such pain." I'm sort of preparing myself mentally and emotionally about going into an African hospital and seeing very sick children with Burkitts lymphoma. Just thinking about when I obviously physically first see children with Burkitts, because I know it's so visible, and I know there are some very upsetting cases where the tumours are actually in the eyes of the children, which is going to be quite horrifying to see or upsetting to see. But, and I know this again from experience, I very much do not want to react and show any kind of that I'm upset. I want to make the children feel there's nothing different about them, that they, you know, they may have this awful disease, but they're still that person. And I just know how important this is. And the last thing I think even a child and a human being wants to be reminded of what they've got. They want just to have that feeling that people are there to see them and that they happen to have this ghastly, awful disease. And one's there to make them feel better, that the day is worth living, and there's hope. Can you give me a brief overview of Burkitts lymphoma in Malawi?
Burkitts lymphoma is the commonest childhood tumour in children in areas of Africa which has a lot of malaria. So it's not throughout Africa, not quite so much in the north, not quite so much in the south. It tends to be where there's heavy rain, where it's hot, and of course that's where we get malaria. It's associated with a virus called Epstein-Barr virus, and probably throughout Africa children get that virus much earlier than they do over in the West. In the West it causes glandular fever, and that tends to be something that teenagers get, whereas here I think we don't even know when the children get it. It's probably a very non-specific viral sort of upper respiratory tract problem before the age of 5, and certainly sometimes before the age of 2. In Malawi, it's our most common tumour. We would say probably about 60% of the tumours that we see are Burkitts.
What distinguishes Burkitts lymphoma from other cancers?
Several things, and when you think about cancers, Burkitts is remarkable for how quickly it grows. It's the most rapid growing tumour known in man. It doubles its cells every 24 to 48 hours, so it's very aggressive. It has peculiar places it tends to present, and the one that's very well known and is quite common is on the jaw. So you'll get a big lump on the jaw, or maybe upper sort of cheek here, behind the eye, pushing the eye forward. In the abdomen is a very common place, but actually you can get it virtually anywhere, but those are the common places. And I think what really, and of course the age that you tend to get it, it tends to occur, there's a little peak round about the age of 6 or 7, and then another one in early teenage life. They do tend to be rural. They do tend to be in areas where there is a lot of malaria. I'm just asking her to turn around a little bit. Right, yeah. Actually, she had just turned a little bit this way. She had 2 big swellings on each side here when she came. And her teeth were displaced. You can see they're still a bit displaced.
Yes, yeah.
And she's very she's very near the end of her treatment, and she's done very well. Her eye is something from the past that's not to do with this. And when we do a lot of other investigations, we look at fluid from the spine, we look at bone marrow, we look at blood to see if it's spread anywhere, and we do an ultrasound of their abdomen. She was clear, so we're hoping that she will be completely successful. So this is Edina. Edina's 13 years old, and she came to us with severe difficulty breathing. She actually had fluid on her lungs. When we felt her tummy, she had a lot of fluid there with lumps in it. Very short story, just a month or so. Right sort of age, actually, for Burkitts, particularly when it presents in the abdomen. So it was a matter of treating her quite urgently. She's nearly finished her treatment, which has taken a month, and she's done remarkably well. Ukupuma bwino tsopano, Hey. Ukuyenda bwino, kusowera, kudya, kusangalala. Asking her whether she's eating well, walking, whether she's happy, and she's agreeing to it all. Yes. So she had fairly advanced Burkitts lymphoma because she had a lot of fluid in her abdomen as well, and of course that fluid has a lot of cells in it which may spread. Our treatment is nothing like as intensive as it is
in the West.
I don't think our children would tolerate it. We don't really have the supportive treatment to manage it. And we're finding that we're getting about 48 to 50% complete cure, which means a year with the treatment that we're giving, which, as I say, takes a month. The drugs cost about $50. That means we can treat a lot more children than we would if we went in for very intensive care, very intensive therapy for 1 or 2. And yes, we're quite relieved with what we've been able to do without causing a lot of severe side effects. So this mother went to a health centre, was given penicillin and ointment, waited 2 weeks, didn't get better, went to another clinic, got the same, didn't get better, went to a private clinic, got 2 injections, didn't get better, went back to the first one, and they said, no, this is not good. Sent her to the district hospital, who sent her here. So that took mother 6 visits to get her. Grace, so she's had this swelling since April, and she came in and through the eye department because I think the thought was that it was a primary eye tumour. But when you asked clear and careful history, it had clearly started behind the eye and pushed the eye forward and destroyed the eye as it was growing, and it's grown very quickly. So we had to make the assumption that it was a lymphoma and probably a Burkitts, because that's common here. Well, of course, we suspect it the moment we see it, particularly if it's in an obvious Burkitt type of an anatomical site. But then we need to know what it is, and so we take what we call a fine needle aspirate. We put a needle into the tumour and aspirate it, put it onto some slides, send it off, that's stained and looked at, and has quite a classic picture. We then need to know where it is. We want to know how widespread it is. So we do ultrasounds of the abdomen to make sure that we're not missing something in one of the organs there. We take some cerebrospinal fluid to see whether it's spread into the central nervous system, and then that's the time when we can also give some treatment to prevent or to treat. And we do a bone marrow to see whether it's spread into the bone marrow. And obviously the more widespread it is, the more difficult it is to cure. He's Ganizani, and he's 2.5 years old, which is very young for Burkitts. Yeah. And I'm not actually entirely sure that this is a Burkitts. We're treating him as such while waiting for cytology, which sometimes takes rather a long time. We really didn't feel we could wait when he's got something in his eye, behind his eye. And it may turn out to be something called a rhabdomyosarcoma. He's very miserable. Yeah. He hasn't been here long, and all he wants to do is to be held, really. Yeah. Do you know Balidi? March, April, May, June, yeah. So, 2.5 months maybe of a history. So it's pretty rapid growing. And I don't think he's got any sight in that eye. We try and convince ourselves it's getting a bit smaller. He had quite a significant lump there before. He thinks I'm going to inject him. We haven't had his cytology results yet, and we thought we must try and preserve the sight in that eye, and so we've given him some treatment in the hope that it will reduce. As I said, the age that these children present is usually 6, and Ganizani is only 2.5.
Do you think this disease carries a stigma in Malawi?
I think that's difficult. I think the families are very loving and caring towards the children, and I don't think that it affects their relationship. But inevitably there is some gossip in the village, and it may be that because it's such a dramatic thing that sometimes it's thought to be bewitchment or something supernatural rather than natural.
Tell me, how did you become a traditional medicine doctor?
It started off with my parents. They were traditional medicine people, and they would send me to go collect all the roots and stuff. And when they died, they left me with everything. And it's the same thing that I'm doing with my son, who is sat next to me. I can pretty much cure anything apart from HIV/AIDS. Right now, I'm doing my research. I'm talking to a lot of people, I'm praying about it as well, because I believe that nothing is impossible if you pray to God. So right now I would say that I can cure everything apart from HIV/AIDS. There's a lot of things that are happening around here. Like, I'm very happy that the hospital have allowed me to set up office just outside the hospital. What happens is, if there's diseases that they can't do anything about inside, and I can do something about, then the people come out here. And for me as well, there's certain things that I can't sort out. If someone doesn't have blood in their body, I will tell them to go to the hospital for iron tablets and things like that. So I would say that we are working hand in hand, and it's a successful partnership. It's an informal partnership, but I say we are working hand in hand.
Do you have a lot of people coming to you with cancer?
People do come to me with cancer, and I do help them. They do come with tumors, be it on the face, in the stomach, on the legs. I've seen quite a lot of them, and they've come here and I have helped them. I don't believe that God created a disease like this so that people can suffer. So I believe that sometimes it's inflicted on you by other people. You might have fallen out with them and they would do something that you get a tumor. It is a cancer that has come from witchcraft. There are ways of finding out. It's like casting bones, but instead of doing that, we put maize flour in a bottle, and in the bottle we add water. And when we've made that mixture, we pour it on the ground, and we are able to read from that whether it's a cancer that's coming from witchcraft or not. It was pneumonia and an allergic reaction to something. Gave him medication, but it didn't help. When the nosebleed started, it lasted about 3 days. The night before I took him to the hospital, I gave him aspirin, but when I woke up the next day, he was still bleeding, so that's when I took him to the hospital. When we went to the hospital, they gave him medication, but it didn't help, so I went back home. After I went back home, I was advised to take him to a traditional medicine man, where I took him. They tried to help him, but it didn't change at all. We went to Balaka Hospital, where they tried to help him, but it didn't help that much, so we went back home. And he started to swell on one side, so his whole side was swollen, the one side. And then we went back to the hospital. That's why they told me that his lungs and his liver were swollen. The traditional doctor gave him some medication to drink, and he also made some incisions on his body. But after one day, nothing had changed, so I decided to go back to the hospital. The medicine man said whatever's happening to Precious is something that someone is doing to him. It's witchcraft. That's what he said, and that's why he had to make the incisions on him. The witchcraft thing didn't make any sense to me, because even after he gave the medication and did what he had to do, nothing changed at all. But when he came here, the same day that he took the medication, I did see a change.
Do the medicine men in the villages slow down the process of diagnosis with these children?
Yes, I think it does happen, simply because a parent may well go to a traditional healer first and then wait to see if that works. And when they see it doesn't work, then they will go elsewhere to see whether somebody else has something better for their child. So yes, if a parent chooses to go to a traditional healer first, and many do, then there probably is some delay. Perhaps the traditional healer should do the same as we should and say, if things don't go well, go for help elsewhere.
I'm heading north, where a lot of the families I've met at Queen Elizabeth Hospital come from. I thought it important to visit one of the rural villages there to understand the problems these villagers face, and also to get a sense of the distance these families have to travel in order to get to hospital.
I'm a chief through my parents. My parents were chiefs, and now I'm the chief.
What are your main duties as the chief?
Before you go to the medicine man, you have to come and report to the chief just in case something happens at the medicine man's house. So you just want to play it safe, really. So you come and report to the chief first. In terms of cancer, traditional medicine does not help at all. That is what we've experienced. It's very bad practice. Basically, what they are trying to do is to get money off of people. They will tell you that I can cure everything, but that is not true. You take your money to them, they take the money, but it doesn't cure your disease. So it's something that needs to be addressed. I would say that in terms of the welfare of the village, the future doesn't look too bright. We've got so many families, some of them are not very well to do, and the support for these families comes from within the village. And the village, as you can see, is not that well to do. So the support that we get is from within the village. But it would be nice to get something from outside the village, some sort of injection that would lift us from where we are now. There's a lot of poor people in the village, so if it continues to be like that, the future won't be too bright for us. I'm really glad to hear that they're now giving chemotherapy at Queen Elizabeth Central Hospital. We were not aware of that. Maybe as well, that's one of the reasons why people are reluctant to go to hospitals, because they're not aware that you get the same treatment as you get in the private hospitals.